Tameka, thank you so much for joining us on MD Newsline podcast. Can you please introduce yourself to our audience?
Thank you for having me. My name is Tameka Carter.
Mhm. And then, so we're here to talk about HS, and I'm really interested to find out what was your journey to diagnosis with HS? When did you first start recognizing symptoms, and what
hmm
were some of those symptoms?
Yeah. So originally, my symptoms started as a kid, honestly. Um, but at the age that I started noticing the symptoms, it was not a thing, or at least to me. So that was probably in grade school, maybe seventh, eighth grade. Going through adolescence and then into my late teens, it was something that came and went, came and went. Again, didn't think that it would be anything major until um, probably around the time I started having kids, my early 20s, is when the symptoms of pain started to come more regularly.
So when you say it came and went, what were some of the symptoms you were experiencing in grade school?
Boils or
Mm,
bumps,
mm-hmm.
as I would call it. A painful bump is what I would call it. It was something that would come in my groin area. It would come and then it would burst, and then it would be gone, and it would stay gone. 6 months to a year. It would come back and would be gone. Um, in my early 20s, when I had my daughter, that's when I started noticing that it turned more into a cluster and it was more painful. And that was the pain that um, drove me to kind of dig, but at the time it was more so going to my primary care doctor to alleviate the pain. Then I still didn't receive a diagnosis until just recently, 6 years ago,
Wow.
2019.
So when you were going to the doctor, even, younger, were you thinking these were just razor bumps or
Exactly. Because in my adolescence, right, shaving was a thing, right? So that's exactly what we thought it was, or what I thought it was. And even in the areas that I was getting it, I was told that it could be chafing or irritation, but not HS. HS didn't come up until 2019.
wow.
Yeah.
So you get a little older, you start having kids in your 20s and you start getting more clusters and more pain.
Yes.
So when you first went to the doctor, what was their original diagnosis? Were they still saying razor bumps? Like what were they thinking it was at first?
Cyst or just a boil. I remember even before I had my daughter, my primary care doctor just thought it was a cyst in my chest area, and we drained it. A breast surgeon actually drained it, but HS didn't come on the platform for me, at least at that time. That was way before I was diagnosed. That was in 2007.
Mm.
So that it was just a cyst or cyst.
And so when they were treating it like it was just a cyst, was it still happening kind of spread far apart just
Yes,
every once in a
every
while?
once in a while.
And you talked a little bit about drainage. Were they giving you other kind of remedies or treatments or things like that? Were they recommending anything like hot compress? Were they giving you
Not at that
antibiotics?
time. It was more so a topical when it would burst, and that was it. Your skin would heal itself, which it did. Everything that they said would happen would happen. But the more painful or the more drainage or even the more tunneling, I did not start to see until later on.
Mm.
So if a boil or a cyst came, it would rear its ugly head, it would burst, it would be gone for sometimes a year and a half. I wouldn't see anything.
And did you notice anything just as far as the time periods that these would come on? I know sometimes depending on
Mm-hmm.
hormone
Yes,
fluctuations, you talk about when you start having kids.
yes,
And so were you noticing that
yes.
pattern at all or?
At first I didn't, until I started to see a nutritionist, and my nutritionist told me to pay attention to my time of the month. And that's when I started to realize that the flare-ups now were happening. And that's when I started to pay attention. I started to reading more about HS, and it's before my diagnosis, actually. And that's kind of would gear me towards seeing my primary care doctor first, and she brought up HS. And that's kind of how my diagnosis came about. But yes, my cycle is what kind of was the flag for me.
Mhm. Interesting. A lot of patients, sometimes you get people who do their own research, and
Mhm.
then sometimes you get people who have absolutely, they don't do their own research or don't have time
Mhm.
or interest in that. So when you were reading about HS, what tipped you off that that's what it might be, or how did you even come across the term HS if you had known?
Yeah, so, that's a funny thing. Google is like this engine that we love, right? So I Googled cysts in the specific areas I was seeing it, and that's when HS popped up. And there was this picture of a woman's body that had these areas under the arm, under the breast, in the groin area, in the buttocks area, and it covered literally every area that I was affected. And as I started reading the symptoms, I'm like, oh my goodness, this is what I'm experiencing. And I know we're taught not to diagnose ourselves, but everything that I was reading at that moment just checked every box for me. And I kept going back to it. I was like obsessed with it at that time. It was like, aha, this is it. Because when you don't know, it's when you become more curious. And when I zoned in on that, that's when I was just like, oh my goodness, I have something. But I still had to kind of go through obviously the doctor and get medication. And around that time is when it really, really started to take over my life as far as the pain. I was going into having my second child at that time. It was 2016, 2017. So that's when I was really starting to dig because it was really affecting my everyday life.
Mm. And so you have this hunch of HS. I'm so curious, was the patient picture that you saw, was it a black woman or was it
It was just like a
a
diagram, like
diagram?
yeah, kind
Mhm.
of just like an outside and outer of a woman's body. And
Mhm.
it was just kind of shaded in the area that it would affect a woman.
Mhm.
And it was just hitting on like every area that I was affected.
So you see this, do you go
Mhm.
back to your primary care physician, go, "I think I have this," or what was the conversation like that led to the
Yeah, so the first thing was I was in pain at the time because it was a constant flare by that time. It never went away. I would say around my time of the month and with my diet, it would get worse, but it never left. So I told her what I thought I had, and when she looked, she was like, "Oh, yeah, that's exactly what you have." And from that point on, I went to a dermatologist.
Mm.
Mhm.
So, when you finally got the diagnosis,
Mhm.
what changed about the treatment that
Mhm.
did your course of treatment change from what
Mhm.
you had been doing before the diagnosis, or
Mhm.
did your thoughts about nutrition change? What happened?
Yeah, so the treatment definitely changed because I was just self-medicating with pain meds and warm compresses. So the first dermatologist that I saw, it's trial and error, let's try this, let's try that. Nothing really stuck out for me. Nothing really worked. We tried biologics, injections. Nothing worked. We tried the steroid injections that alleviated some pain, but it's very temporary. Um, until I decided that I really wanted to see someone that specialized in this condition. I think that was very, very important for me. I needed somebody that actually targeted this because they know where to begin instead of this trial and error. Everything could be trial and error for anybody because one thing may not work for everyone, right? So for me, it definitely changed once I started to see a dermatologist. It was like a whole regimen of different things. I had bags and bags of medication every 2 months to try. So it definitely changed.
And when you had these conversations about medication, even before you went to someone who
Mhm.
specialized in
Mhm.
HS, what was kind of the conversation about what to try first? What was the communication? What decisions did you have to make, and what might have impacted those choices?
What was important to me, which was pain, um, and drainage. With HS is a lot of drainage. So those were the two major things that I was trying to target. So that's what we would go after.
Mhm,
Is trying to alleviate the pain and get in front of the draining.
mhm. And did you feel like you kind of understood the options that your doctor was giving you? I know sometimes these treatments and medications can be complicated.
Mhm.
Was it easy for you to follow? And did you feel like you were able to kind of make informed decisions or?
Yeah, yes and no. I feel like, when you're given so much information, it could be very overwhelming and trying to keep up with what could work and what may not work. Um, so yes and no. It just depends on I guess who's delivering the message, right? And what the medication is targeting, I guess. In the beginning it was very, very overwhelming. I think one medication that we were trying to shoot for, I had to take a pregnancy test every week to make sure it was very, very harsh. And it was unorganized in the dermatologist's office how it was supposed to go. So that was very overwhelming. So it depends. But in the beginning, it was tough.
Mhm.
It was really tough.
So was it kind of the frustration of the m- the experience with someone who didn't necessarily specialize in HS? What led you to seek out a specialist, and then
hmm
how did you even find your specialist?
yes, it was
Super specialist, I should say,
yeah,
because
super
yeah.
specialist. Yeah, I was frustrated with I guess dealing with pain. You kind of become numb to it, but I was looking for relief and I hadn't received anything at that moment. So I was frustrated to answer that question. And the more I read, the more I thought to myself, I really just needed someone who was focused on this. And I started to read about doctors across the country who focus on HS. And that got me to, I'm like, we're in Chicago. Like, I know there is somebody who's a specialized doctor for this. And I did come across a specialty doctor. So
And who's your doctor?
Dr. Onajan.
Yeah, we've interviewed Dr. Onajin on
Yeah,
the MD Newsline podcast. She's great.
she is great.
So you just started researching.
Mhm.
Somebody knows something. Tell me about when you first started working with Dr. Onajin. What
Mhm.
is the difference when you're dealing with maybe the previous experience that you had, and
Mhm.
now you find a super specialist,
Mhm.
and you go over there? What was the initial difference in
Yeah, it
whether?
was like night and day. Dr. Onajan was very aggressive. I remember at a doctor's appointment, she's like, she stated, Tameka, I'm very aggressive with my treatments. If we do not see any progress or any change within a certain amount of weeks, we move right along to the next thing and to the next thing. And what I appreciated about that is I think a lot of times doctors or providers, they, you know, they think that one thing works for several patients. And she was like, no, this doesn't work for you. Let's go on to the next thing. I can't tell you how many biologic injections I have been through with Dr. Onajan because they did not work. And she listened to me. And she's like, you've been dealing with this for a very long time. And if you call my office or send me a message and say you're in pain, I know that you're in pain. So if it doesn't work for you, then we move on to the next thing. There are other options and combinations that we can try. And I appreciated that.
And when you say, it doesn't work, I'm really
Hmm.
interested in that concept,
Yeah.
because sometimes when people go to the doctor, it's not always clear, especially when they tell you, like, this might take a while to get,
Yes.
really get going, and
Yeah.
you've been dealing with the pain, which means you're kind of
Yeah.
used to it to a
Yeah, yeah,
certain
yeah.
amount, and you don't know what to expect, like if you're
Yeah.
expecting too much. So
Mhm.
what went through your mind as far as like translating, okay, I don't think it's working versus maybe getting stuck where some people might get stuck at like, I guess this is as good as it gets. What was that kind of
Yeah.
conversation that
That's
you
a good
guys had where
question.
you were
So Dr. Onajan told me if we get to 50 or 60% of a pain relief, that is good for you. And we did. We got beyond. And that's how we knew that treatment was working. And once we got beyond one course of a treatment, she's like, we're going to go to the next one. And that's how we went from 50 to 60 to 70 to 80.
reduction in pain?
Mm-hmm.
Wow.
Yep, absolutely.
It's amazing. So
Mm-hmm.
she was basing it on your specific
Absolutely.
percentage of pain.
Mm-hmm.
That's really interesting.
Yeah.
So when it comes to other things, so the pain is kind of subjective,
Yeah.
based on what you're experiencing in your body. Then you
Mm-hmm.
mentioned like the drainage and things like that.
Mm-hmm.
What were some of kind of the ways that you gauged that, and did it meet your expectations, go beyond your expectations?
Yeah, it did. I will say, in addition to the treatment, we did have to do procedures to remove some skin, which I was extremely nervous about. I think, in anything related to a lot of scar tissue, your confidence just kind of, especially, for a woman, it just goes down, right? But Dr. Najan was very patient with me, so that has helped tremendously too, getting rid of a lot of scar tissue. So, um, i- in addition to the treatment plans, the medications, the dieting, and the procedures that we've had, a combination of all of those, it helped across the board with the drainage, the pain, and it wasn't overnight, it took some time, but with the beginning of the treatment, I started to see a reduction of the drainage like immediately. And she kind of let me know like, it's working, but we still have to get rid of the tissue, the damaged skin tissue. And I thought, do we really?" Like, the medication is working, but that too, on top of, became like, "Oh my goodness, I feel even better," once it was healed, of course. So, it's just like a combination of things that played a part in what you see over time.
And talk to me a little about this conversation. You mentioned a nutritionist before.
Mhm.
Talk to me a little bit about how lifestyle and nutrition has
Mhm.
played a role in all this, what you've
Mhm.
learned, what's been most impactful for you specifically, if you don't mind sharing.
Yeah. So I'll say that diet is probably the biggest target for me when it comes to HS. So one thing I noticed prior to my diagnosis, it was something that I just picked up. Um, Refined sugar, dairy, those things are flare monsters for me. So before I was even diagnosed, I just noticed how I would feel just body-wise, period, when I would ingest those things.
How were you feeling?
Sluggish,
Sluggish?
tired,
Mm. Because sometimes
bloated.
people say, like, I think sometimes people normalize how they feel after they eat certain foods, right? And so somebody who understands nutrition be like, I don't like how I feel when I eat this. And then it's like, well, how do you feel? Because
Yeah,
somebody might be feeling that same way and think this is just how I feel when I
this is
eat.
normal.
Exactly.
It's
And it's
not
like, especially if you've been dealing with it your whole life.
your
So
whole
you're
life.
talking about sluggishness, kind of
Tired, just drained. So one thing I
bloated.
started to eliminate was soda. I haven't had soda in like 7 years. And that was just one day I'm like, "Oh God, this sugar is just a lot." So one day I just stopped. I haven't looked back, and I cannot tell you how good I feel without drinking it. So little by little I started to eliminate small things. And then when I started, and this was before the HS diagnosis. So over time, when I started to learn that those things play a part in, the flare ups, I started to like putting it together. Like, oh, that makes sense. It
Mhm.
makes sense why I feel the way I feel.
And did your nutritionist tell you this, or did Dr. Onajan tell you this? Like, where was
This
this
was
information?
before I met Dr. Onaj, and this was more in when I was seeing a nutritionist.
Mhm.
Um, when my nutritionist was telling me to pay attention to my menstrual cycle and the things that I was eating, and that's when I started to like really, really pay
Mhm.
attention.
So they weren't necessarily targeting HS specifically. They're just like, how do you feel what
You
makes you
eat
feel what
this,
way? And then they're like,
yes.
you might want to stop this because clearly it's
Mm-hmm.
not making you feel
Mm-hmm. Exactly.
interesting.
Yeah,
Yeah.
exactly.
Just as far as other information that you've gotten, is there any information that you've gotten that surprised you about foods that might impact HS specifically?
Yeah, so obviously, we always hear balanced diet, but I don't really think people understand the extent of that. Um, I would say for me, staying away from the greasy and the fatty foods consecutively. It is okay to indulge because we all love that. The holidays are coming up, but in moderation. Moderation is like the biggest thing. So I know that I may like a certain thing and I'll indulge in that. I'll take it. I won't starve myself of certain things, but I just won't overdo it. So I'll just, for myself, I'll just take it easy. I won't overdo it.
Hmm,
And that's
interesting.
that's one thing I've learned about myself is I don't need too much of anything.
Are you tracking anything? And also, if you don't mind me asking, are there
Mhm.
any maybe comorbidities or anything that
Are
might
there what?
comorbidities, like other
Mhm.
kind of maybe health things that
Mm,
run concurrent to the HS, or is
mhm.
that your main focus?
HS is the main focus.
Mhm.
There are no other things, thank God, underlying. Um, so that's
Mm.
my main target right now.
And then has this impact, you mentioned you have kids, has this
Mhm.
impact how you talk to your kids about nutrition and health and
Mhm.
wellness at all, or how has
Yeah.
that impacted the
Yeah,
conversation?
absolutely. I have a 17-year-old daughter, and she has unfortunately mentioned having a boil. So we've had this conversation. The good thing is, I have experience with how to treat it and what to do if you have it. But when we're speaking about nutrition, this is something that comes up, and it's very important that we speak about it, especially being a young woman with our hormones and our cycles. This is something we discuss
Mm.
often, actually.
And how has your relationship with things like health information
Hmm.
evolved over the years? This is probably the most that I've heard anyone, patient specifically, talk about doing their own research, which we're big. Obviously, this entire show is about patient advocacy and sharing information. How has your relationship with health education changed, and how maybe do you talk to people about it,
Hmm.
this kind of self advocacy?
Yeah, I would say advocating for yourself is very important. Um, do not just receive information and be okay with it. Um, get other options, other opinions, read, educate yourself on what's happening with you, and speak up. Say what you feel, say what you don't feel, say what's working, what's not working, what you think. Only you know.
Hmm.
And you have to have a care team that is going to listen to you. That's very, very important. And if they don't, do not be afraid to move around. That's very important. That has been the number one thing for me. Having Dr. Onajan and her team actually hear me out has helped tremendously.
What are some of the things when you say having a care team that listens to you? What does that
Hmm.
sound like from a patient
Oh my
perspective?
goodness. Just sending a message and saying, hey, I'm in pain. Hey, this isn't working for me. Hey, I'm having this sort of reaction.
Mm.
Hey, can you call me? Hey, can you help me? Hey, can I get an appointment sooner rather than later?
Mm. And what does a satisfying response sound like to you when you say something like, "Hey, I'm in pain,
Mhm.
this might not be working?" What is a an equitable conversation sound like to you where you're like, "Okay, we might not necessarily have solved the problem, but I know that I'm talking to somebody who is paying attention in the right ways and is on my side." What does that response sound like from a care team or a doctor?
Mhm. Hey Tameka, can we call you so we can discuss? Or hey Tameka, we found time and Dr. Such and such is scheduled for you to come in.
Mhm.
That to me is an acceptable response.
Mhm.
Um, and it's appreciated. You know, it is definitely appreciated.
And I want to step back a little bit because you said
Mhm.
something about how some doctors think that one treatment route
Mhm.
works for everyone. How did that play out where you're like, okay, I don't think this is working? Were they saying, okay, you got to give it time? And you were like,
Mhm.
I've given it enough time? Or
Mhm.
what did that look like where you're like, I don't think this is the right treatment? Because you sometimes don't even know what all your options are
You
if you're
don't.
getting,
You don't.
so how did you come
I'm
to
gonna
that?
be very honest. If something was not working for me, I stopped. You know, I had a biologic that reversed and it caused more harm than good. And before I can get another appointment, it would have been a couple of months. And unfortunately, it was just a side effect of that medication. But by the time I did see the doctor at the time, they did acknowledge that this medication has, caused this issue. Um, but I was told you got to give it time. It's only been 7 months.
That's a long time.
It's a long time. And you know your body, right? You know what you feel, and especially when you've been living with the condition for a while. And I'm not by any means condoning someone to stop a medication, but I'm just saying this is when you have to reach out and get second opinions and other and third and fourth.
Mhm.
You have to.
'Cause you can tell when you're getting
You
worse.
can tell. Like something is not right. You
Mhm,
have to listen to yourself. And you can't just say, oh, I'm going to keep going.
mhm.
You're a year in and you've caused more damage than anything. Now you have to reverse and treat um, the initial issue.
Very interesting. What do you wish that doctors knew when it comes to talking to patients who are dealing with, you know, a complicated issue or something that they've been dealing with for a long time or something that's very painful? What do you wish doctors knew about
Hmm.
communicating with patients?
That a patient has been living with this condition all their life or half their life, or even if it's just 2 years. So they may be the medical experts, of course, but still, just hear the patient out. Just listen to what they have to say. Take what they're saying and their feelings and their thoughts, their suggestions into consideration.
Mhm. What would you say to people who are either dealing with HS
Mhm.
or patients in general, or people who feel like they might have HS? What would you want patients to know about, self advocacy, navigating the medical system, and things like that?
Mhm. Um, continue to advocating for yourself and to again find a care team that will listen to you. To do your own research. That's very important.
Mm,
Very important.
fascinating.
Mhm.
Well, this has been an amazing
Mhm.
conversation. Thank you so much for joining us, Tamika, on MD Newsline podcast. It's been
Thank
a
you for
pleasure.
having me.
Of course.